Hello there. So last class we were describing the muscles of the hip and lower limbs, but we only described the anterior ones. We described the flexors and the adductors of the hip and the extensors of the knee. Remember, only the muscles crossing anteriorly and medially. So today we're going to discuss the other part, the muscles crossing posteriorly and laterally the hip and posteriorly the knee joint. So we're going to describe today the extensors and lateral rotators of the thigh and the flexors of the leg. For it sounds okay. Again, uh, here is the list of all the muscles, the huge list of muscles that we're going to describe today. Okay, and in there, the surface anatomy landmarks. Do your chart. Highly recommend, and I actually included this video, which is the first video from the last class. I highly recommend to watch it again to review all the movements and the mechanics or that applies to the muscles in the hip and lower limbs, okay, before this class. So pause, go, watch the video and come back. Another reminder. So last class, remember this is only your cross section of through the thigh. So this is your femur. Last class we described already the anterior compartment. We described the group of quadricep muscles and the sartorius. We described, check. Last class also the medial compartment, all the adductor muscles, their innervation, their actions, done. Today we only need to describe the hamstrings on the thigh, okay? And remember, these hamstrings are crossing, are in the posterior compartment of the thigh, are crossing posteriorly the hip joint, and they're crossing posteriorly the knee joint too. So since they're spanning two articulations, they have actions in here at the hip and in here at the knee. So in here, since they're crossing posteriorly, what can they do? Well, still, in these parts is the same as everything else we have described. So they perform extension. Is that correct to say? No. You need to complete your sentence. So you have to say extension of the thigh or extension of the thigh at the hip. And in here, since remember the fetus rotation, so in here the hamstrings are going to flex the knee, okay, or flex the leg at the knee. Okay, it's like you have here a string, right? So the string is woo, when you pull it, it lifts the leg. That's how I see it. All of these compartments, all the posterior compartment of the thigh and thigh and leg are innervated by a branch of the sciatic nerve that we'll describe in a little while. And this is the first group of muscles that we're going to describe today, which are the muscles. We're still not in the thigh. We are back here, posterior to the hip joint, but we haven't reached the thigh yet. Okay, so we're going to describe these group of muscles, which are the gluteal muscles, the ones that make your buttocks. So we have three of these muscles. The bulky one, the one, and the biggest of them is this one, which is the gluteus maximus. Gluteus maximus. It reminds me of Optimus Prime. I don't know why. So gluteus maximus. Let's cut these gluteus maximus, and then we're going to see under the other two. This is gluteus. This is gluteus maximus. They cut in here. In here we can see gluteus medius. They cut they cut it too, and underneath gluteus minimus. Okay, I'm gonna show you with my super duper duper app the the origins and the insertions of these muscles. So I think this is easy, right, to locate. This is the gluteus maximus. Let me show you the origins and insertions. And anatomy is everything about these descriptions. So if I throw you an image, you don't have to memorize, well, the gluteus maximus originates where? Look at that. In the coccyx, in the sacrum, and in the posterior up aspect of the iliac bone. Where is the insertion? Where the insertion, can you see it right here? Do you remember the lines behind the femur that I was describing last class? This, I think I cannot do it while this is on. Let me try again. Oh yes, no, I can't. Well, this is the pectineal line, and this is the gluteal tuberosity, this line in here. And they fuse together, kind of. But the thing is that in the middle we have the linea aspera. So, gluteus maximus inserts in the gluteal tuberosity of the femur, and right here you can see it, right? We will see it in the picture again, in the iliotibial tract, just like tensor fascial lata. So tensor fascial lata inserts on the tibial tract anteriorly, and gluteus maximus inserts also in the iliotibial tract, but posteriorly. One flexes the hip, the other one extends the hip. One medial rotates the hip, tensor fascial lata, the other one, gluteus maximus, lateral rotates the hip, okay? And I just told you the actions of gluteus maximus. Now, those are secondary actions, abduction and lateral rotation of the hip. The prime action, the main movement in here is extension at the hip. Actually, gluteus maximus is the prime mover for extension at the hip. But it's not that you're going to work out this muscle just, well, I'm going to extend my hip. Anatomical position is extension, right? So I'm going to be standing or walking and I'm going to work out my gluteus maximus. Ain't going to happen. You need, in order to engage this muscle, it extends the hip when it goes from a flexed position. So you can call it like this, standing from your chair to a standing position. Okay, I can do this like 10 times, and this is a squat, like squatting, like climbing the stairs, lunges, of course. Any movement that where your hip goes from a flexed position to a standing to a position, okay, that's where gluteus maximus acts. The innervation is given by inferior gluteal nerve. Now we have two gluteal nerves, the superior and the inferior. You will think the superior supplies the gluteus maximus. It's the inferior, okay? It's the only time we're going to mention this nerve in the entire course. The inferior gluteal nerve innervates gluteus maximus. We will see now the superior gluteal nerve innervates, we mentioned last class, tensor fascial lata, and the other two, gluteus, medius and minimus. Now let me show you the minimus. The medius and minimus. I'm going to remove a layer, going to remove gluteus maximus, and then you can see in here, that's your gluteus medius. See, it's deeper to the gluteus maximus. Let me show it to you right here. Okay, you can see in there, it's the origin is in the iliac, in the gluteal fossa of the iliac bone. You remember the lateral aspect of that bone, and look at the insertion. What is that? That's the greater trochanter of the femur. Okay, let me show you right away gluteus medius. gluteus minimus. So I'm going to remove a layer. See? Almost the same. It's almost the same, but it's minimus. It's smaller, tiny. See? Again, originates in the same gluteal surface of the iliac bone, but inferior to the origin of the gluteus medius. And the insertion is the same, greater trochanter. So what do you think? They both have the same action. These are the abductors of the thigh. They abduct the thigh, open your thigh, and they medially rotate your thigh. Innervation, as I told you before, is given by the superior gluteal nerve. Okay, so remember, superior gluteal nerve serves also, the two gluteus, the medius and minimus, and also tensor fascial lata. Inferior gluteal nerve only for us, for my class, the list of muscles, according to the list of muscles that we have, only the gluteus maximus. See you in the next video.